Thank you, Susan. Some peek behind the curtain of the UK's COVID-19 response. So now on to the panel discussion, and my notes are saying that we've got Professor Brett Sutton joining us, but apparently they all become sirs. So is it better to say Sir Brett Sutton? Sir Brett Sutton? Anyway, I don't know if I have to introduce him. It was in all of our living rooms for about 2.5 years. But anyway, Professor Brett Sutton has extensive experience and clinical expertise in public health and communicable diseases, gained through emergency medicine and field-based international work, including in Afghanistan and Timor-Leste. Most of you probably know him as Victoria's Chief Health Officer, and in this role he undertakes a variety of statutory functions under health and food-related legislation and provides expert clinical and scientific advice and leadership on issues relating to public health. So please join me in welcoming Brett to the stage. Thank you. Joining Professors Mickey and Sutton is Adjunct Professor Terry Slevin. Professor Slevin is Chief Executive Officer of the Public Health Association of Australia and previously served as Director of Education and Research at Cancer Council WA. He holds adjunct professorial roles at the College of Health and Medicine at Australian National University and National Drug Research Institute at Curtin University. Professor Slevin is among Australia's most prominent experts and commentators on public health research, chronic disease prevention and health promotion. Thank you, Terry. And last but not least, we have Professor Peter Raddle. He is currently Professor of Information and Technology and Deputy VC of People and Organisation at Victoria University. Prior to this, he was Pro-Vice Chancellor Indigenous at the University of Canberra. Professor Raddle has conducted research over many years on a range of matters of importance to the Aboriginal community, with a particular emphasis on information and communication technology issues and the digital divide. He's also on the board of the Smith family and the Victorian Chamber of Commerce and Industry. Thank you, Peter. Okay. So first question to Sir Sutton. Would you be able to reflect on your response to the pandemic as the Victorian Chief Health Officer and how behavioural science factored into the decisions and recommendations? If they did, I hope they did.
Thank you. They certainly did. Look, it's been an evolving space. Obviously, it's been a long time. And we initially had the support of a legislative and statutory power that was very significant. So once the pandemic declaration was in place or the state of emergency was in place, those public health orders were a cornerstone. But in late 2020, we obviously had our second wave, a really challenging time for Victoria and was part of our very long period of lockdown. We knew that there was multi-layered support that was required, and so it did go to the COM-B elements, and there were federal and state elements of the enabling environment, so the support, understanding that many of our challenges were with casual workers, with multi-generational families, with the CALD community, and with others who were in a position of socioeconomic disadvantage where they had other priorities and they had other commitments that made it very difficult to support the behaviours that we required of people. And so we did invest a great deal of energy and prioritisation of the behavioural enabling that we could, that went to the communication elements, that went to opportunity, that focused on a really simple and hopefully straightforward message. And it was a complex time because we were moving through various stages of the public health orders, in and out, and the rules changed quite frequently. But I think really central messages about test, trace and isolate, or test and isolate for individuals, and the vaccine message, which was very steady, I think was a success. We had bicultural workers, we had community vaccination champions who were representatives of the communities that they were serving. And we had loads and loads of engagement, as well as trying to work on the opportunities, especially for vaccination and testing. So the drive-through testing sites, and then vaccination that went from the state centres that were very high profile, but right to the pop-up centre at the end of the street. And they were really critical for that last, 1 or 2%. And Victoria achieved the highest level of geographic equity for vaccine coverage in Australia. We didn't have a local government area that was below 94% vaccination coverage, I think, for the first dose. And we had one of the highest, if not the highest, in terms of socioeconomic disadvantage. And so that difference between the lowest and highest quintiles on the index of relative socioeconomic disadvantage was small in Victoria compared to other jurisdictions internationally and in Australia, and also to how it might have played out. There were over 5% of the Victorian population who were reached just on Zoom calls, many of which I was on. Prof Ben Cowie as sometime acting Cho, also in lots and lots and lots of engagements. And so, having over 100,000 people reached just in Zoom calls so that you could answer those specific questions, concerns, anxieties that people had about vaccination, testing, isolation, the whole shebang, we tried to enable to the fullest extent possible. So maybe slow to get started, but we absolutely made it central to how we achieved the success of getting back to zero COVID transmission in 2020.
Thank you. So thinking nationally now, I'm going to switch to you, Terry, as CEO of the Public Health Association of Australia. Curious to hear your thoughts on Australia's pandemic response, bearing in mind this event's being recorded, so you might want to be a little bit careful with what you say. But positive outcomes, but also missed opportunities. Where could we have gone a little bit better? What did we do amazingly?
Thanks for the heads up about the recording. Very helpful. Avoid me getting into jail. Thank you, Michelle. Firstly, thank you to you and University of Melbourne for the invitation to join. And Susan, thank you for your presentation. I stood fascinated by the dynamic and the play out of what was clearly a strong investment in sound advice, which fell on deaf ears. Let's be blunt. Happily, that didn't unfold in the same way in Australia. We had the clear advantage of a stonking great big moat around us in the oceans to the north, south, east and west. And it's important to recognise the role that played. That's never to underplay the extraordinary efforts of people like Brett, the leadership of the AHPPC, the genuine commitment of government, state and territory and Commonwealth. So there was a level of commonality of purpose, particularly in that first year in Australia, that I think most people could see. And there was certainly debates at the margin, and I'm sure Brett was involved in some of those knockdown, drag-out debates about the best way forward. But for the broad sense, it was clear that Australians got on board with dealing with the pandemic, recognising and seeing what was going on in the Northern Hemisphere and the disaster that was unfolding there. And particularly in the first year was a fairly extraordinary response. And I think it's important never to dismiss that and to thank all of the people who are involved. And whether you like the government of the day at a state level, at a national level, whether you like the politicians, whether you like the Chos, whether you liked the person who was doing the contact tracing, all of those people, I genuinely believe did an extraordinary job. So it was a time when public health should very genuinely be extraordinarily proud of the effort that was made. Now, as time has unfolded, the debates have become more vigorous and more complex, and the debate between back to normal, if you want to capture it in that way, versus the pandemic's not finished and we need to continue with some of those controls has become far more complex and far more nuanced. And I think we're still at a relatively good position compared to comparisons of like countries around the world. And I think that's objectively a reasonable observation. Could it have been better? Absolutely. We learned a lot of holes in the system. And here's where I'm going to stray into the less conservative and offer an observation. I'll be talking about this more tomorrow, and I'll be talking about it in fact all year, and that is there were commitments made in that early part of the pandemic by our national leadership under the newly created National Cabinet about investment in public health, which has simply failed to materialise. So that immediate all hands to the pump to deal with the dragon at the gate was very, very effective. But since then, the interest has been lost. Since then, the focus, the priority has gone elsewhere. And you've seen in Victoria, and we've seen it everywhere in Australia, the focus on the pressures on the public hospital ramping, ambulance ramping, the extraordinary pressures on the tertiary care system. And the investment in, even the preparedness to discuss investment in public health infrastructure has almost completely disappeared and is quite frankly a disgrace. And to be blunt, this state is one of the worst offenders. You've just gone through a state election where the words public health seem not to pass through the lips of anybody aspiring to form government in this state. I was astounded and flabbergasted and blind with fury, and so too should you be. My best guess is that the government who won the election had good polling to suggest that the actions that they did take early in the pandemic, and those firm actions which reduced the impact at a great price to you as Victorians, still had sufficient support because people appreciated and understood the benefits of so doing. But the prospect of then strengthening the system so that it's ready to deal with the next assault, so that the infrastructure is in place to deal with not only communicable disease challenges, but the ongoing and enormous tsunami of chronic disease challenges that do have genuine evidence-based public health solutions, remains completely ignored. And I think that's preposterous. I think it's time that people started thumping tables.
Are you going to be thumping that table tomorrow when you talk about the CDC?
I'll be doing it even before tomorrow evening. I'll be doing it tomorrow morning.
Thanks, Terry. Peter, over to you. See you nodding quite a bit. Did you have any thoughts about Terry and Brett's comments there?
Yeah, for sure. Can I just start off acknowledging that I'm a bit of a ring-in today. My dear colleague, Pat Dudgeon from Western Australia, was unable to make it, so I was greatly accepted the invitation from me and to step in on her behalf, but she's the person with all the amazing knowledge. Having listened to the conversations, very interesting from the Aboriginal community. I should say also, like Daniel, I was born during the day. My mum's Aboriginal, my dad's German descent, and identify as Anawan, which is in northern New South Wales. Had a great career in academia, but looking at really challenging environments is one of the things that I've really struggled with over many times, as a lot of us do, is how do we actually create, and I'm sure Terry next to me and Brett as well and others in this room will actually understand just the struggles in the Aboriginal community to actually achieve any recognition or address long-term challenges, and it's a real problem. One of the things that I really struggled with during the pandemic was the anxiety in the community, particularly more remotely, if I can say that, more remote parts of Australia. We thought that if and you'll see this if you read a lot about this, you'll see there was a fear of loss of not only culture, language, ceremony, and it was really almost like a sort of a PTSD moment for the community, if you like, in that this happened a couple of 100 years ago as well, but a different context. And here we are listening to government officials saying, we're going to jab you with good stuff this time. Last time it wasn't so good when we laced your water holes and so that sort of thing. So that sort of led to a really difficult situation, I suspect, for public health professionals, because all of a sudden you had this conspiracy, vaccine hesitancy, and particularly in remote communities, in more remote areas, the idea of social distancing is couldn't be further from anyone's vocabulary and language in community, because there's no such thing as social distancing when you have in remote communities, no matter what goes on. And if you ever have the opportunity to go visit a remote community, I'm not sure if anyone's done that, but it really is definitely an eye-opener from every perspective. One of the things that I just mentioned this to Ian earlier, one of the things that I think from that perspective, from, of course, the hesitancy, the public health issues, the comorbidities that go along with deep, what you would understand is deep, really challenging issues of, lots of challenges. diabetes, housing. I mean, it goes on forever. It really does. But to address those, it does need a big push. And if we can't get decent health care for non-Indigenous Australians, well, what do we do for Indigenous Australians? It's a real challenge. One of the things that I try to do in my research, I try to look at how do we. So it's kind of attached to this, and I love the idea of behaviour and opportunity, but I try to look at how do Aboriginal households use information technology in different ways for social engagement, for how do you book an appointment, how do you get onto the MyGov portal. These are things.
You don't.
It's a real challenge. Even if you got a couple of degrees in IT, it's still a challenge because it's nothing to do with IT. It's on the telephone for hours. But it's a real problem because those are sort of the gateways or the pathways to get access to things that you need. Things like the Hot Doc app, for example, and those sort of things to get access to healthcare. It's really difficult. And I still struggle to understand. And about 60% of the Aboriginal community is attached to the internet in some way. And between, I was just sharing again earlier, it's a real problem. In my discipline of information technology, the diffusion of information technology has always been positive, except for some data that my colleague Boyd Hunter and I found between the two censuses in 2011 and 2016. The Aboriginal community, about 15% of Aboriginal households, gave up the internet between those two censuses, which means it creates a disadvantage. It took us as much, and my colleague's a quantitative researcher, he had to do a lot more hard work than I did to get that paper published because, to be quite honest, the editors didn't believe that there was a disadoption or an anti-diffusion of information technology in Aboriginal households because it doesn't exist in the non-Indigenous community. So it's really interesting. So it took us 3 years to get that published, but we do have the data now to show that not only do we start from a point of disadvantage, but then that disadvantage doesn't stop. Okay, so that it exacerbates. If I can just say one thing about the Victorian. I do, for one of the best things I get to do is sit as a director of the Smith Family Board, and I look at different cohorts of data. Victoria's kids are really struggling for numeracy and literacy. You can see that. We get to compare all states and territories with all our kids in those communities. Smith Family only deals with education programs. They don't do any charity type work. But I think the saddest thing for me to look at the data is Aboriginal and Torres Strait Islander kids in Victoria particularly are struggling with numeracy and literacy. And without that connection to information technology is actually really tough for them overall.
Great, thank you. Susan, I'm going to go back to you. Now that you've sort of heard from Brett, Terry and Peter, any reflections on sort of the UK response versus the Australian response? And, Terry mentioning that chronic disease is still an issue that, public health has sort of, gone away now. Are we seeing this sort of same thing in the UK, or are we still sort of battling the pandemic over there? Not that we're not battling over here.
Well, I think is this working?
Chief IT officer as well, Brett.
Well, I think just the data spoke in the talk about the much better management over here in terms of the transmission rates and driving it down. And I think having had the privilege to talk to Brett earlier and listening to him now, I think having a trusted source is really helpful. We lacked that. Having people speak with the same voice is really helpful. We lacked that. We had different politicians saying different things at different times. I think having clear messages, not too many of them, is really important. We had mixed messages, confused messages, and I think that reflected politics, the different political views on things. So I think if you have a cohesion around public health and its role and trusted people leading it, then I think you're well on the way to doing things right. And we were talking last week, was it, about the next challenge that I also referred to which is we're not in a crisis anymore, but we're still in a pandemic. And how to achieve this in terms of people maximally protecting themselves, when obviously one part for all of us is, yes, we want to pretend it doesn't exist and get on with our lives, but we know that's not the case. And I think getting over this sort of, to people, the kind of layered approach in terms of protection, and that one's, sorry, I realise I'm sort of talking to you and I should be talking to everybody, that often people think, well, I'm not vulnerable, I'm all right. But I think, there's been good evidence that you're doing this not just to protect yourself, protect your loved ones, protect your communities, protect the health service. And going forward, I think, 3 messages, and almost saying there's a layered approach to this. Each layer you take will give some protection. Nothing will give 100%, but the more layers you take, the more protection you'll get. So vaccination, I think there's a 5th one coming to Australia, pushing for that. The other thing is, where possible, socialise and do your activities outside. If indoors, make sure it's ventilated or HEPA filters or whatever. If that's not possible, indoors, where there's not sufficient ventilation, wear a mask. There's 3 things. I think more than 3 is too much, but I think getting over to people that if you do all those 3 things, that's pretty good protection. Even if you do one of them, it's better than nothing. So that if people have got some kind of opposition to one of them, say the vaccination or say the masks, they don't just throw the whole lot away and say, well, my identity is that this is all a load of rubbish, I'm not engaging in it. But, there's something there for hopefully everybody to do something. And as we know, if everybody's doing something, it adds up to quite a lot.
So you talked about, I guess, singing from the same hymn sheet, making sure that anyone who's fronting the media, a credible source, everyone is on message. Do you think that contributed to the difficulties, is that so many people were giving out so many different messages? It wasn't just 3 that you've just mentioned. There is all this other stuff and people just got confused, became overwhelmed.
Yes, I mean, one of the discussions we've had about, why we wrote good reports on how to communicate effectively in these kind of situations. What is the reason for the government not following that advice? Is it an opportunity issue? No, it's not an opportunity issue. They had the opportunity. They had the scientific advice. They have the power. Is it a capability issue? Very few of our government have any science understanding. So yes, there probably is a bit, even though I'm sure our Chief Medical Officer and Chief Scientific Advisor did a good job of communicating the advice. Is it a motivational issue? And I think most people think yes. I think a lot of what was underlying it was ideological, and there was a couple of things that happened that were pretty catastrophic in terms of numbers of deaths. One was delaying when that shouldn't have happened in terms of lockdown, with very catastrophic consequences. And you could say, okay, this is a new situation, they got it wrong. But then there was following September, there was a call, and from SAGE, they gave all the data, all the modelling, why we needed, we call it a circuit break, I think we called it, in September. Clear advice, it wasn't followed. So I think that, there was a whole lot of reasons underpinning it. But what it then meant was people just got confused and angry in some cases, or anxious because they didn't know what to do. And once you get that, you then get groups of people who say, you know what, I'm just not engaging. That person's given me permission to not bother with this, so I'm going to go with that. And you just get such divisiveness. My son and his family moved to Portugal during this period, and so I visited Portugal several times. And one thing that's, and masks everywhere, and what such a contrast between the UK. And one thing that really struck me is actually they're a very cohesive society. They defeated fascism not so many decades ago. They're a very collective, very cohesive, trusting society. So I think one of the points is one needs to really look at the whole of society. when thinking about how to do this better. Yes, there's all the pandemic management strategies, but I also think there's some more generic things that would help with all of our public health challenges, not just this one.
Thank you. Moving on from the pandemic, if that's allowed these days, curious to know, each of you curious to reflect on what you've learnt over the last few years and what lessons you might like to take moving forward, not just in relation to pandemic and airborne diseases, but climate change, equity. What have we learnt? What are we taking forward? I did send these questions to you beforehand, Terry. Don't look so surprised.
Okay. I guess the first thing I would say is that Australians value health at a very, very high level. You all who were in this room made extraordinary sacrifices for your health and for your community. And I genuinely see that long-standing effect, probably more so in Victoria than anywhere else I go, because of the unique circumstances here. So that's a really important thing for us, I think, all to take away, to accept that people are prepared to make sacrifices for their health and the health of their families. Now the challenge for us is how do we make use of that to better serve them, to prosecute that objective. So I guess I also take away a sense of hope that actually, while democracy is a pretty crappy system, it's the best one there is. And we do genuinely have a chance to influence the future. And we have seen it serve our needs, I think, at a very high and successful level. And we all grizzle about it, and we all think it sucks and it doesn't work and it doesn't meet what it needs and it doesn't work the way we think it should. But there's a lot of pressures within the system, and I think ultimately it serves us pretty well as long as we're active. What I've learned is if we are passive players, if we don't take advantage of the privilege we've had of education, you're unlikely to be in this room unless you've had that privilege, then there's a sense in which you have a responsibility to feed that back. And the challenge is to figure out the best way to do that. So if you have the expertise, you can genuinely provide advice that steers your society, our community, our people in a more constructive and healthy direction, then you should nail your colours to the mast and be prepared to say so. So I guess what I learned is it's not a spectator sport. Get on the field and kick the ball.
That sounds like a tweetable thing if anyone's tweeting for today. Anyway, Peter?
Oh. You got to keep yours, boss.
There's a couple of things I would say. There's an image in my head that I remember from the pandemic. I think it was at Wilkenya, when COVID hit Wilkenya, which is a remote part of New South Wales. And to help with isolation, they bought, I think, 8 or 10 little motorhomes out there, and they parked them all in a line, thinking that it's going to solve the public health issue with the pandemic and address social isolation or fix social isolation. I thought that was quite comical, actually, and I think a lot of people did, because it did nothing except park a whole heap of white trucks on the side of a road somewhere, which is interesting. So that's one thing I would say, that our solutions for Aboriginal public health, not that creative. The other thing I would say, I was during the pandemic, just before the pandemic, I joined the Capital Health Network Board, the PHN in Canberra, and when the pandemic hit, we thought that was going to be a real problem, because the PHN was, providing primary healthcare services, particularly the clinics, the respiratory clinics, and the AMS did not have any connection to the PHN because they had not spoken for the best part of 18 years. And it was a fallout over data sovereignty. Okay, so this issue of, the Aboriginal community wanted to make sure that the data that we gave up to the federal department or the PHN was going to be used in a way that would be empowering for the community. And they felt it wasn't. But when the pandemic hit, one of the really good things is, whether it was I was there or whatever might have happened. But we actually resolved that issue, and we had a COVID clinic at the AMS, and that was the first time we've had anything to do with each other in 18 years. So I think that was a very positive thing that came out through that collaboration.
Thank you. Brett?
Yeah, thank you. Look, I agree with Terry that there was an extraordinary time in Victoria where we were absolutely and unequivocally focused on the health of the community, and it was wonderful to watch. They were supremely challenging times, but I think it was a reflection of that willingness to think about what we need to do individually and collectively to protect our health and well-being across the board. On the flip side, I really did see the kind of incipient danger of misinformation and disinformation. I think that's now providing me with some reflection on what the future challenges might mean from a communication perspective. I hope I was a trusted voice in the COVID space, but trust is a really precious commodity. It's hard to build. I think it's got some resilience. I think you can make some missteps. I think you can get stuff wrong and still be trusted as long as you're an authentic voice, as long as you kind of speak directly to the changing challenges, changing environment, and communicate that directly. But the dangers of disinformation now are coming through as we talk about other challenges. You can see this Venn diagram of vaccination denial and climate change denial. You can see the way that the things that you would traditionally communicate about risk to health, like an extreme day of heat, people now say, what are you even telling us that for? You know, it's summer, you idiot. And all I can reflect on is no one would have said that 5 years ago, but it's being used in a way to disempower people like me and the voice of government because there's a sovereign citizen movement, or there's a movement to really marginalise the voices of science and the voices of factual information. And that's a danger, and it's especially a danger to those who are more reliant on social media channels for the information that they get. The called community often go to country of origin for their information, and we need to be in that space providing factual information, but also in a digestible, motivational and engaging way so that they pick it up. In many respects, the success that Victoria had with our Aboriginal community was there was trust and the key messages were there, but we also got out of the way. We had Aboriginal communities speaking to Aboriginal communities about what was required, hearing what they needed and responding directly. And so that devolution and decentralisation of the public health response was really critical in Victoria. And I think that's a lesson for climate change going forward, for local action. I think it applies to any of those black swan left field threats to health that might come in future. We need to be able to have trusted voices in the community responding directly to people's concerns.
Thank you. For anyone coming to our conference tomorrow, we've got a great couple of sessions on misinformation, so please join us. Susan, I'm giving you the final word.
What was the question? Well,
everyone's so surprised. I sent them the questions beforehand.
I'd forgotten. Well, first of all, I completely agree with Brett. I mean, there's no shortcut to engaging with communities, consulting with communities, developing things jointly with communities. So I think that's a big thing to learn. I think the disinformation, misinformation, I think there's a huge amount that we need to do. So, I mean, one of the lessons I think is preparedness. Another one is research, because it's shown some of the things that we do know and that we do know work, we just didn't do it well. But there's a lot of other things where actually there's new questions have arisen. How do we do this, and how do we do this better? So I think trying to join up, if one's in government, trying to join up, the health, the environment, the research, make sure that those aspects of government at whatever level are working together. And I'd say, thinking about, I don't know who everybody is, but I'm assuming a lot of academics, but a lot of people are users of evidence too. I think joining up researchers and scientists with those who are using it in ongoing way. Ongoing partnership is another message I'd take. And, you know, there was somebody mentioned about optimism and hope. You know, I think there's you know, the fact that we've got a very large inquiry happening. You go through something, as everybody said, you know, some things worked well, other things didn't work well. Now, the ratio of that is really different in different countries. But learning from one's own experience, also learning from other countries. You know, if the UK had only learnt, you know, from all the countries that have got so much experience of dealing with previous SARS, etc., would have done so much better. So I think joining up within one's country, joining up between researchers and users of research, and joining up across borders and across continents, I think is really important for the way forward.
Thank you. Lots of food for thought there, and hopefully you're all sticking around because we've got actual food coming now. So please join me in thanking all our panellists. And that's it. We're done. Thank you.